All right, let's dive right in. Today, we're going on a fascinating journey deep inside our own bodies to figure out the incredible story our blood is telling us. And believe it or not, it all starts with a couple of numbers you've definitely seen before.
Yep, that's the one, 120/80. You see it at the doctor's office, you hear about it on TV, but have you ever stopped to think about what it actually means? Well, I'm here to tell you it's so much more than just two numbers on a screen. It's really the first clue to understanding the power of your entire circulatory system.
So let's start right there. We're going to decode that number. If you think of your veins and arteries as this massive, sprawling river system, then blood pressure, that's the force that keeps the river from standing still. At its most basic, that's all blood pressure is. It's the force of your blood pushing outward on the walls of your arteries as it travels. And, the hose analogy is just perfect. If you have way too much pressure, you risk damaging the hose, right? But if you have too little, the water is just not going to get where it needs to go. It's all about that balance. And that's exactly where those two numbers come into play. That top number, the systolic, that's the peak pressure. That's the big squeeze, when your heart muscle contracts to push blood out. Then the bottom number, the diastolic, that's the pressure when your heart relaxes between beats. It's this constant rhythm, squeeze, relax, that paints the full picture of what's happening.
Now, those readings aren't just random data points. They actually slot you into very specific health categories. You can see here the ideal normal range is pretty tight. And from there, if the numbers keep up, you move into pre-hypertension and then into different stages of hypertension, which is just the official term for high blood pressure. It's a roadmap for your cardiovascular health.
But here's the thing. Your blood pressure isn't set in stone. It's actually changing all day long. A really easy way to remember some of the big things that affect it is with this mnemonic: age, stress, activity, and salt. I mean, everything from how old you are to how stressed you feel to whether you just ran up the stairs can make those numbers bounce around. Okay, so we've talked about the force, the pressure in the system. But what about the river itself? Let's zoom way in now and take a look at what this river of life is actually made of. Turns out, your blood is basically two main parts. Just over half of it, about 55%, is a yellowish liquid called plasma. That's mostly water. But the other 45%, well, that's what we call the formed elements. And these are the cells that are doing all the real work. You can think of these formed elements as your body's own microscopic A-team. Seriously, it's this highly specialized crew of different cells, and each one has an absolutely critical mission to keep you alive and well. So let's meet the team. The plasma is kind of like the highway system they all travel on. Then you've got the red blood cells. They're the oxygen couriers, making deliveries to every part of your body. The white blood cells, they are your 24/7 security detail, constantly on patrol for invaders. And finally, the platelets are the emergency repair crew, rushing to seal up any leaks or cuts. Pretty cool, right? And that security detail, the white blood cells, it gets even more interesting. It isn't just one type of cell. It's a whole squad of specialists. Here's a little inside scoop. Clinicians have this great mnemonic to remember the main players, from the most common to the least. Never let monkeys eat bananas. It's a fun little trick to remember them all in order. This whole system is incredible, but what happens when it gets overwhelmed? What if there's a major injury or a big surgery, or the body just isn't making enough of these vital cells? Well, that's when we have to call for backup. And that backup comes in the form of a blood transfusion. It's a really powerful medical procedure where blood, or sometimes just specific parts like only red cells or only platelets, is given to a patient through an IV to replace whatever's missing. And these transfusions are absolute lifesavers. They're used in all sorts of critical situations, like for severe blood loss, which is called a hemorrhage, or to support a patient through a major surgery. They're also used to treat conditions like severe anemia, where the body just can't get enough oxygen around on its own. Okay, so giving someone else's blood is an incredibly powerful tool, but it's also a big deal, and it comes with risks. Because of that, the entire process is wrapped in layers and layers of strict safety rules and requires an immense amount of precision. It's really managed in 3 key phases. First up is the prep. This involves checking and double-checking absolutely everything: the doctor's orders, the patient's consent, their vital signs. Then you have the procedure itself, which always starts slow while the patient is monitored like a hawk. And finally, there's the follow-up, which is all about documenting the process and watching for any delayed reactions. All that close monitoring is absolutely essential because of potential complications. And the one that everyone is watching for, the most dangerous of them all, is something called an acute hemolytic reaction. This is basically a worst-case scenario. It's what happens when the patient's immune system recognizes the transfused blood as a foreign invader and viciously attacks it, usually because the blood types were mismatched. The warning signs hit fast and hard: a sudden fever with chills, severe back pain, a sharp drop in blood pressure, and even blood showing up in the urine. If even one of those signs appears, there is no debate, there's no second guessing, there is one and only one number one action, and it has to happen that very second. Stop the transfusion immediately. Every single moment counts.
To help remember the whole spectrum of potential risks, healthcare pros use another powerful mnemonic: fatal shock. Each letter stands for a different potential complication, from fever and allergies to fluid overload and sepsis. It's a pretty sobering reminder of why being so incredibly careful is non-negotiable. So you see, from the simple pressure in your arteries to the complex team of microscopic cells working around the clock, your blood tells this amazing, dynamic story. And understanding that story, knowing what's normal, what the risks are, and what the warning signs look like, that's really the first step to taking charge and becoming the CEO of your own health. It's powerful stuff.